Welcome, ladies and gentlemen. Thank you for joining me today. This presentation is about the World Health Organization, or the WHO, and the COVID-19 setup. We must start with the director of the WHO, and bear with me, Tedros Adhanom Ghebreyesus, and we'll just refer to him as Tedros for the rest of this presentation. He was born March 3rd, 1965, and is an Ethiopian microbiologist and internationally recognized malaria researcher, who currently serves as Director General of the World Health Organization, a position he has held since 2017. Reading from Wikipedia, from 2005 to 2012, Tedros held the government position of Minister of Health for Ethiopia. From 2012 to 2016, Tedros was Ethiopia's Minister of Foreign Affairs, so not even medical. He was a straight politician at that point. He was born in Asmara, Eritrea. The family originated from Enderta al-Raja of the province of Tigray, and as a child, he recalls being very aware of the suffering and death caused by malaria. Now, I'd like to point out here that hydrochloroquine and zinc, the malaria cure, is the same thing that seems to be curing SARS-2, or COVID-19 as the foreign-controlled media tells the sheep. So I immediately must wonder how the WHO or its director haven't come out officially for this medicinal cocktail. The doctor must understand its use, based on what little we've spoken thus far about him. Quickly, again, in case you didn't catch it, he's an internationally recognized malaria researcher. And, based on his growing up in Ethiopia, as a child he recalls being very aware of the suffering and death caused by malaria. So, you'd think that he'd know that in the least this drug is safe, no? As opposed to what the satanic media is saying, how people are dying from it. You'd think he would have stepped up by now and set the record straight on this drug. Very interesting. I've never understood how a drug that's been on the market for decades is being considered less safe than rushing through a vaccine in record time for this virus, as Bill Gates wants to do, without an elongated period of safety trials, etc. Just another Twilight Zone moment, I guess. In 1986, Tedros received a Bachelor's of Science degree in biology from the University of Asmara. In 1992, Tedros received a Master of Science degree in Immunology of Infectious Diseases from the London School of Hygiene and Tropical Medicine at the University of London. In 2000, he earned a PhD in Community Health from the University of Nottingham for research investigating the effects of dams on the transmission of malaria in the Tigray region of Ethiopia. Again, I got to keep thinking this. It seems he'd know a little bit about hydrochloroquine, and I'm baffled as to why he hasn't spoken up. Continuing, in 1986, Tedros joined the Ministry of Health as a Minister of Health, where he received praise for a number of innovative and system-wide health reforms that substantially improved access to health services and key outcomes in Ethiopia. In 2001, Tedros was appointed head of the Tigray Regional Health Bureau. During his time in this position, healthcare staffing was increased by 50%, immunizations for measles was raised to 98% of all children, and total immunization for all children under 12 months was raised to 74%. The percentage of government funding for the Tigray Regional Health Bureau was increased to 65%, and overall, 68.5% of the population was provided with healthcare services within 10 kilometers. Now we can see that, as he is credited here with being a vaccine shill and getting most of the children of that country vaccinated. The globalists love it. The cabal love it. Bill Gates loves it. Now, follow along here with this info about when he was a Minister of Health of Ethiopia here. In October of 2005, Tedros was appointed Minister of Health of Ethiopia by Prime Minister Meles Zenawi. Despite the many challenges faced by the health ministry in terms of poverty, poor infrastructure, and a declining global economic situation, progress in health indicators was considered impressive in Ethiopia. During the period 2005 to 2008, the Ethiopian Ministry of Health built 4,000 health centers, trained and deployed more than 30,000 health extension workers, and developed a new cadre of hospital management professionals as part of a health extension program, or an HEP. Furthermore, in 2010, Ethiopia was chosen by the U.S. State Department as one of the U.S. Global Health Initiative Plus countries, where the U.S. will support innovative global health efforts in that country. So, a couple things here. Ethiopia was and still is broke and mismanaged, creating a poor infrastructure. They needed money to support it, as they can't or couldn't do so on their own. Enter the U.S. State Department in 2010 under an obscure politician by the name of Hillary Clinton, and you might have heard about her. The State Department under Hillary Clinton awarded Ethiopia as one of the U.S. Global Health Initiative Plus members. The U.S. Global Health Initiative, huh? Sounds real similar to the Clinton Global Health Initiative, doesn't it? What is the U.S. Global Health Initiative? Well, it was introduced by President Obama in 2009. The U.S. Global Health Initiative, or the GHI, is an overarching approach to U.S. global health policy that seeks to strengthen, streamline, and increase the efficiency of existing U.S. global health programs, including HIV and AIDS, maternal and child health, family planning, and neglected tropical diseases. Global health initiatives, or GHIs, are humanitarian initiatives that raise and disperse additional funds for infectious diseases such as AIDS, tuberculosis, and malaria, for immunizations, and for strengthening health systems in developing countries. GHIs classify a type of global initiative which is defined as an organized effort integrating the involvement of organizations, individuals, and stakeholders around the world to address a global issue. But the reason that I went into this was that I wanted to highlight a cabal tactic that's used. It's used to seize control of a person or an organization and its money, and it's something that the Clintons have done for decades. It consists of a couple different methods. One is, as is the case with most of our politicians and a bunch of college professors and directors, is that you're a dirty, filthy traitor and you sell out for some cash and take your money and do as you're told. And the other is they rescue you, your company, your career, etc., from bankruptcy or ruin, as it seems here in the case with Dr. Tedros. And then shortly after you've spent the money, they come calling for a little more, then a little more, then a little more the next time, etc. It's sort of a mafia tactic. As I alluded to a second ago, Tedros inherited a ministry with a strong vision but little capability to meet that vision. The ministry was somewhat beholden to a donor community that was focused on HIV, AIDS, tuberculosis, and malaria programs when Tedros first assumed his leadership position with a system-based reform agenda. So with little economic surplus, the country lacked capacity to build its own health systems, and much of the Ethiopian human resources for health had fled the country. For example, there are more Ethiopian doctors in the Chicago metropolitan area than in Ethiopia. Tedros designed a health workforce reform strategy called flooding that has resulted in the training and deployment of thousands of doctors, nurses, pharmacists, lab techs, and health officers. Dear listeners, if ever you're in a discussion with a sheeple about our sciences being flawed, please read them this last paragraph that we just read, the part that says the ministry was somewhat beholden to a donor community that was focused on HIV, AIDS, tuberculosis, and malaria programs. See, the money that funds the research gets certain preferential treatment and sometimes preferential findings, and thus it is then preferential science, I call it. Now, this last line here, as Minister of Health, Tedros was able to form a close relationship with prominent figures, including former American President Bill Clinton and the Clinton Foundation, and the Bill and Melinda Gates Foundation. And there's a reason for this, ladies and gentlemen. In my opinion, they needed Tedros. They needed a corrupt sellout to do their bidding. Consider this. In 2009, so right after he was placed into office, Obama launched the U.S. Global Health Initiative. And I'm going to repeat this now. This program is an overarching approach to U.S. global health policy that seeks to strengthen, streamline, and increase the efficiency of existing U.S. global health programs, including HIV and AIDS, maternal and child health, family planning, and neglected tropical diseases. Now notice what this entails. HIV and AIDS, maternal and child health, family planning, and tropical diseases. Now, knowing what we know about these people, if we can call them that, a few things immediately pop into my head. First is, where are the pandemics of AIDS and HIV? What parts of the world and what kinds of countries? Third world? African? Poor? Same thing with the part of this initiative that supposedly helps with, quote, neglected tropical diseases. Haiti, for instance? Again, poor, third world, right? The other thing that jumps out is, and again, knowing what we know of these demons, maternal and child health and family planning. Not sure about you guys, but I wouldn't want any of these Satan worshiping devils involving themselves in my family or children's lives. But can you see what's going on here? Think of Haiti. Think of all these third world countries where child and human trafficking is an epidemic. Think of the war-torn nations that the cabal entrenches themselves in through their Red Cross and their, quote, humanitarian organizations. How many children go missing during the fog of war or the confusion and disorientation of a natural disaster like a hurricane or an earthquake? Are you awake yet? In my opinion, it's beginning to look more and more like everything these creeps do has a human trafficking and a child abduction angle to it. Yes, dear listeners, the truths that will soon see the light will indeed be difficult to handle for many. This initiative didn't create any new funding, but instead reallocated current funding into other areas and used non-government organizations to help. Now, one of these organizations that partnered with Hussein and his program was the Clintons and their organization called the Clinton Global Health Initiative in 2005. Again, it's just my opinion, but it seems that Hussein's program is mirrored after the Clintons' program and quite possibly was a money laundering op. Basically taking current funds that were controlled by someone not corrupted and getting them into the hands of those on team, and then using these third world programs to then take those funds and get them into the hands of the Clintons. Oh, but it's not just the Clintons now, is it, folks? Do we think that the Republicans of the last 30 years were honest, American-loving patriots? George Bush Jr.? Well, he launched something called PEPFAR in 2003, and that stands for the President's Emergency Plan for AIDS Relief. It is a United States governmental initiative to address the global HIV and AIDS epidemic and help save the lives of those suffering from the disease. PEPFAR has provided more than $80 billion in cumulative funding for HIV and AIDS treatment, prevention, and research since its inception, making it the largest global health program focused on a single disease in history. PEPFAR is implemented by a combination of U.S. government agencies in over 50 countries and overseen by the Global AIDS Coordinator at the U.S. Department of State. It is widely credited with having helped save millions of lives, primarily in sub-Saharan Africa. Latest results from this article, November 27th, 2018, shows PEPFAR has saved over 17 million lives. A side note here that is relevant is that the Global AIDS Coordinator that oversees this $83 billion is named Deborah Blinky Burks. And she's probably a familiar name to many who are listening to any content on this channel. You know, she seemed very beta, weak, etc. in those coronavirus task force press conferences. But this is one powerful person, ladies and gentlemen. Anyone in control of $83 billion is a very sought after person. Believe me. When PEPFAR was signed into law, 15 resource-limited countries with high HIV and AIDS prevalence rates were designated to receive the majority of the funding. And those 15 focus countries were, among others, I'll name a few: Botswana, Kenya, Mozambique, Namibia, and of course Ethiopia, all African. Most of the $15 billion for the program was to be spent on these focus countries. Tedros, at this time in 2003, was Ethiopian state minister, and shortly after Bush launched PEPFAR, about the time the monies were going to be determined and allocated to those 15 countries, Tedros becomes Minister of Health for Ethiopia, putting himself into position to oversee this money transfer. Through bilaterally funded programs, PEPFAR works in partnership with host nations to support treatment, prevention, and care for millions of people in more than 85 countries. Partnership frameworks provide a 5-year joint strategic framework for cooperation between the U.S. government, the partner government, and other partners to combat HIV and AIDS in the host country through service delivery, policy reform, and coordinated financial commitments. Other partners? This is where the Clintons come in. The Clinton Global Health Initiative. It's all part of the same op, folks, all connected. It's a money laundering op worldwide. When researching on these traitors to humanity, always keep in mind that these people operate within a long-term scale. Their plans are 20, 30, 50 years, even a 100-year plan. It's almost inconceivable to those who aren't paying attention. It seems that Tedros was elevated to these positions throughout his career, and I believe it's because he was known corruptible, if that's a word. Bush knew, just like the Clintons and Hussein knew. They know how these third world countries have about zero accountability. PEPFAR and Hussein's global health initiatives are or were basically a way to go into these countries and partner with local, most likely corrupt groups, and then become the default watchdog for the money. Why? Well, they can't do this with programs in the States or in other developed countries because we have a certain amount of oversight, accountability. So how does one get around that? Well, just like what Hussein did to NASA, same MO. NASA had certain accountability measures that it had to operate within, FOIA, etc. By taking our space exploration and giving it to the private sector means no more FOIA, no more accountability, which meant more ability to launder tax money and to keep, hide, and develop new tech that the cabal will control. Same thing here, ladies and gentlemen. So, of course, in 2017, Tedros would be overwhelmingly picked to run the WHO. He has been curated by this point in time since the late 90s, early 2000s. And this is how it's done, and it's not a stretch whatsoever, folks. There's some more info on Tedros. This info is from an Ethiopian news site from April 2017, from the Amhara Professionals Union research paper written a few weeks prior to Tedros taking over the WHO. It reads, "Dear Sir or Madam, the Amhara Professionals Union, or the APU, presents you objective facts about Dr. Tedros, proving that he is unfit to be one of the finalists for the appointment of WHO Director General. The Amharas are one of the most populous ethnic groups in Ethiopia, comprising over 1/3 of the population. The Amhara Professionals Union, or the APU, is a nonprofit advocacy group for the causes related with the Amhara. They're located in Washington, D.C., and they're a civic organization comprised of medical doctors, scientists, lawyers, and other professionals of Amhara descent all over the world, organized to defend the rights and interests of the Amhara people against the heinous crimes that the current TPLF-led regime has been committing for over 25 years. We at the APU share the following statement about Dr. Tedros' candidacy and have attached a paper that exhibits the candidate's overall record at the helm of the Ministry of Health and Foreign Affairs of Ethiopia in more than a decade. We believe that WHO, as an international organization with extended reach throughout the world, should be led by someone who has a proven record of accomplishment of serving human beings without prejudice and shows respect to all humankind, irrespective of their ethnic background or religion. As APU, we evaluate individuals based on their competence and past track records, regardless of their ethnic, religious, or regional background. Dr. Tedros should be judged based on his role as Minister of Ethiopian Federal Ministry of Health, Minister of Foreign Affairs, and as a Politburo member of the Tigray People's Liberation Front, or the TPLF, as I stated a few seconds ago. They're a political party that is the most powerful within the Ethiopian People's Revolutionary Democratic Front, which is the lead government of Ethiopia. Human Rights Watch and many other national and international organizations have widely criticized TPLF for crimes against humanity and atrocities towards the Ethiopian people. The attached document provides objective evidences why APU believes Dr. Tedros lacks the competence, impartiality, accountability, and transparency that we feel are required for a position of this magnitude. The document highlights the following. The candidate has failed to be transparent by forcing the Ethiopian Ministry of Health to not report and cover up a cholera epidemic throughout his tenure by simply renaming a deadly epidemic as an acute watery diarrhea, or AWD, even after the diagnosis of cholera was confirmed. This resulted in an even worse nationwide epidemic. Would they ever change the name of something and call it something else, like say the flu, and call it something else to reach their means? Just thinking out loud. They go on further to say that the candidate has treated his own citizens differently based on their ethnicity, contrary to WHO's goal of building a better, healthier future for all people throughout the world. While WHO strives to better the lives of the underserved and marginalized communities, Dr. Tedros, who descends from the Tigray ethnic group disfavors the Amhara regional state through poor health care. For instance, disproportionately high mortality coupled with selective application of contraceptives has led to a selective reduction of the growth rate of the Amhara people. Such disparities were created and gaps increased across all measures of health in his leadership tenure. This was genocide, folks, just so you understand this. Of particular importance is the unexplained 2.5 million decrease in the Amhara population under his healthcare leadership. The Amharas were victimized and punished due to their ethnic background. We understand that accountability, integrity, transparency, and honesty are among WHO's core ethical principles. Sadly, Dr. Tedros has failed to meet all these standards while he assumed his role in the aforementioned post. Therefore, we at the APU believe that it would be a travesty of justice if WHO awards its highest position to a person who violated WHO's core principles and whose deliberate actions and inactions have claimed the lives of millions of Amhara people as well as other Ethiopians. We are dealing with communists, ladies and gentlemen. And I won't go any further into this, as the good doctor's history is pretty well known by now among the groups of people that would be listening to this channel. I first learned of this, I think, from X22 report a week or two ago, and Dave did an excellent job. And if you want to dig on this, start with Dave. He does an awesome job. Let's now fast forward. It seems the WHO was lying about the SARS too. It seems that the WHO was setting the United States up. Sound ridiculous? Impossible? Well, check out this Daily Caller article. On January 14th, the WHO, under Tedros, the terrorist, told the U.S. and the world that coronavirus was not contagious human to human. This, ladies and gentlemen, was one day before Nancy delivered the articles of impeachment. I want to point out a post from our anonymous source. A ticking time bomb? 2007? When was SARS 1? 2003? So the WHO had experience with SARS from 17 years ago. And the first SARS outbreak in 2003. Then in 2007, the American Society for Microbiology writes a paper on this stuff, about it reoccurring like a time bomb. But the WHO said to the whole world on January 14th that it was not contagious. Now, how on earth could they make that statement, dear listeners, when they know this, they've read this document? They can't make this. They can't make that statement. They had to have known. So why then? Well, to get rid of Trump, of course. Here's my opinion, for whatever the hell that's worth. It seems to me that the WHO is working with China, the Dems, the rhinos, and the deep state. It looks like they planned on downplaying this virus, using the WHO's own words, and then using the distraction of the impeachment trial to keep everyone's minds off of the virus that was, at this time, heading to America and infecting many, in order to allow for thousands of people getting infected before anyone even knew it was here. Then they would summon their MSM and other establishment controls and hammer the president for, quote unquote, allowing this to happen. In fact, that's what they're attempting to do right now. I honestly believe that these demons would have tried to bring negligent homicide charges upon him. I really do. I also see their other reinforcing angle here too. I see Bill Gates and other fake news agencies claiming China had only 3,300 deaths from SARS too. I see CNN exploit this claim just the other day. They're asking the question, how could the U.S. have 15,000 deaths while China only 3,300? We see Gates again touting the CHICOM response, claiming that their extreme intervention worked. Ladies and gentlemen, if you believe that the country of China, with 1.3 billion people, mostly living in poverty and as peasant farmers, only had 3,300 SARS-2 deaths, well, I got some oceanfront property in Arizona that I could get you a really good deal on. And 3,300, to me, and probably many of you out there, is a very interesting number too. Maybe they're signaling to their cohorts that those numbers are controlled by them, the cabal, the sun-worshipping, Satan-worshipping cult that runs things. I see CNN ask the question, how could America have the highest death toll of all countries? See what's going on? That statement alone, to me, exposes what their entire SARS-2 plan was. Phase 1 was to allow the virus to sneak into the U.S. pretty much under the radar and fester for a month or two while Trump was busy defending impeachment while the world was watching. Phase 2 was to hype and inflate the numbers of infected and the number of dead, creating hysteria, making the problem seem bigger because, after all, these numbers have been less than the flu. Phase 3 was to then show how America, the most wealthy nation, America with the most sophisticated medical apparatus in the world, America supposedly the best at these things, had failed. Of course, failed under Trump. It would show Trump was in over his head. It would show that Trump, even with the wealthiest, most sophisticated nation with regard to medical industry, failed the American people. And as stated earlier in this presentation, I honestly believe that they would have attempted to slap involuntary homicide on him. Whether it would stick or not is a whole other story. And like most every sinister plan from the satanic cult, it was multi-pronged. You see, they never do anything for just one reason. Everything that they do has multiple uses and benefits. This SARS hoax was also a great way to hide Biden's deficiencies and hide Trump's popularity by limiting debates and Trump rallies. This also created a great distraction from the Joe and Hunter Ukraine quid pro quo with Burisma. Another huge thing that it does is it crashes the U.S. economy, or so they thought it would. Also, again, hurting Trump politically. Finally, this was their opportunity to attempt a full-scale vote-by-mail campaign, and we all know how that goes now, don't we? Yes, it's all right there in front of you, ladies and gentlemen. And I'll leave you today with the end of drop 3929 from our anonymous source. And it's something we have said here on this channel. It says, if you look, you can see. I want to thank you for watching this presentation. If you enjoyed it, please click the like button. And don't forget to share and subscribe.